Well, it was the G7 global vaccine confidence summit, and I think the UK wanted to. It was their gesture to say we need some leadership around this issue of confidence, and in the G7 they. And we worked closely with them on a number of things, and they said, "Listen, this is an opportunity to engage a few countries around the table to actually start thinking and taking it seriously, actually, because I think that this has been brewing for a while as an issue. I mean, I founded the Vaccine Confidence Project 11 years ago. This is not a brand new topic, but COVID has laid bare a lot of underlying issues of trust and distrust, and where our weak spots in the system are, and where our trust relations are more worn. So in that context, I think they wanted to bring attention to it. It has been a topic, particularly with we're trying to vaccinate the whole world, and so I think it was really in that context to put this on the agenda. And then we have very different publics than 10, certainly 20 years ago. And it's been hard for the scientific and medical community to be challenged, to not have the same 100% trust that they had, and the same some of them it's hard for their sense of authority and pride. At the same time, I think that we've had this whole massive digital revolution that's pushed things in another way. So there's a lot of adjusting to that as a different way of communicating. In general, Africa had reasonably high confidence in general in terms of anticipating a COVID vaccine. Last summer, there were pretty decent high confidence that it would be safe and effective when it was approved, if it were approved. That dropped precipitously in March. I mean, literally in Nigeria, 49% strongly agreeing it would be safe. Last summer, it dropped to 24%. And we saw that dropping on a day-to-day basis as Europe was ping-ponging, whether or not they wanted to use the AstraZeneca vaccine, what the problems were, if there were a problem, how big of a problem is it. It just, shook the confidence of a number of African countries, and some of which are not even using the vaccines from COVAX because they've kind of a mix of reasons. But, one of them is, can we trust it? If they can't even decide what they're going to do up in Europe, why should they send them down to us? So I think that global knock-on effect is another phenomena we're seeing in a new, different light. Well, I think the biggest thing on the table right now is the issue of equity and the massive divide in access to vaccines now, because you can invest a lot into building people's confidence, but if they get their confidence up, but then there's no one home and there's no vaccines, you're creating expectations that it ends up backfiring, and you lose their